feasibly smart of the body. And you would see that glucose problems. You would see that even more in diabetics, which you don't see. So when you're having insulin problems, we always see the blood sugars controlled well with the fruit, meaning that there's no insulin required for that. You can check that out and see that when you play with that with your people that you work with. So you have to explain the difference between polysaccharides, which is starch, that's many sugars, fructoses and glucoses bonded together, creating sucrose, maltose, dextrose, that type of sugar, or with the proteins, you just get that spilled down and work with them that way. Anna Maria, 2979. Ooh, what kind of dog you got there? Excuse me. Man, I got one like that, but he's all chocolate. Dr. Morse, I have a friend 36 years young with the following symptoms and diagnosis. Dizziness, headaches, nausea, tachycardia, dyspnea, palpitation, insomnia, anxiety, panic disorder. When she faces such symptoms, she lies down with her feet up, can't move as feeling so weak. Blood pressure is normal, usually 10 to 11. What do you recommend? She is not vegan, but she is willing to make a change in her diet. Well, let's take off first, dizziness. Well, we're back here at the cerebellum here. This is where her lymph is backed up into her cerebellum here. She could have some genetic weaknesses in that, on top of that pressure. So this cerebellum is you really got to move lymph. The problem's up in the cerebellum. That could actually reach and get over a lot of these symptoms, from the headache to the nausea to even the tachycardia. This could all come out of this cerebellum here. Definitely could do that. Palpitation, insomnia. Well, insomnia, back up in the head again. You're back here in the pineal gland. So she's got a lot of lymph things going on in her head. Get that out of there. All I can tell her is please get that out of there. Nothing good can come of this, because this is the lymph system, and the lymph system deals with acids, and acids are corrosive. And corrosiveness on the brain, not good. Nothing good ever comes of this with the eyes. Nothing ever good comes of this with the brain and motor and cognitive skills. Nothing ever comes good of that. Anxiety, of course, you're picking up the adrenals. Why is she having the lymph backing up? And you're going back to her adrenal glands and her kidneys again. And so you really want to get into those adrenals. She's really adrenal fatigued here. She's got panic disorder. She's really down. Could have got into some neurotoxins. Detoxify, detoxify, detoxify. Bring those adrenals up ASAP. Get those kidneys filtering, because you've got to drain your lymph system. And you've got to clean up the bowels. Make sure you clean up the GI tract. Remember the connection we talked about between the transverse bowel and the brain area. Get that cleaned up and get her out. Get your friend cleaned up here. Let her listen to this video, because nothing good comes of lymph stagnation in the head. And tumors start getting on the throat and little goiters and stuff. It's just not worth it. But this is cerebellum problems. And at least some of that. But it all goes to the lymph system again. It's just a bunch of cells and two fluids. Very important, real important that she handle this. And she'll pull up out of this. Tachycardia will go down, everything will go down. I wouldn't give her anything for the thyroid, not with tachycardia right now. And just move that lymph, get those adrenals up, go into those kidneys, and start moving on that lymph system. Anna Maria, 2970, Dr. Morse, can you please talk about vitiligo? What causes and treatment? Yeah, you can ask Shannon, because she's fighting that now, and we've been working on her pituitary, and it's starting to go away. We got many, many cases of this. Skin pigmentation changes, and it's all coming from the pituitary here. Of course, in the cases where you have, excuse me again, a lot of lymphatic problems, you're going to have some pituitary problems. So go into the pituitary. She probably has some menses problems as well if it's a female, but this is definitely the pituitary. And you want to get on that pituitary, and then your skin pigmentation will balance out and become normal again. Let me see. This is Michael, Mr. Truth Forever. Oh, man. He's been a fan of ours. He's also lost 40 pounds and has seen the positive results. My interest is in your teaching stem from my need to find a solution to years and years of chronic fatigue. Yeah, I mean, really hit your take the parasite in and really clean you out that way. And then, of course, move lymph and get those adrenals up. Because when you look at chronic fatigue, you have multiple sources of that. Epstein-Barr virus has always been blamed on chronic fatigue, which is stupid. It's easy to get Epstein-Barr virus out of the body. And then, of course, heavy fungal loads will take that as well. Low adrenal glands with low neurotransmitters. You know, it just goes on down that road. So by getting in there and working on that and bringing that up, you could have real weak adrenals, see what your blood pressure is. Even if your blood pressure was up, when someone's checking your blood pressure, if they can't hardly hear it, not good. Your kidneys can pump that systolic up a little higher and not show you the adrenal weakness. But when you take the blood pressure, if you can't hardly hear the heartbeat, that's real weak neurotransmitters. Real faint. The lingering health problems are as follows. I'm 48 years old. About 2 years ago, I started to lose my libido. Almost never wake up in the morning with something. I've noticed hair loss on my hands and legs. Yeah, I mean, this is acid. You want to get that out of there for the prostate and the testicles. Get that out of there. Get that adrenal up. You're seeing that adrenal hit there with the chronic fatigue, low testosterone, blah, 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 blah. It doesn't matter what your blood work shows up for testosterone, let me tell you. More symptomatic is right here. And that's very suggestive that you're running low testosterone. You run low adrenals anyway. That would just make sense. And probably in your favor right now, though, because running low testosterone definitely keeps the burner down. In other words, lymph is what burns cells bad, no question about it. But you throw a little testosterone, a little estrogen, now you're throwing gasoline on the fire. No question it exacerbates the problem. Kind of God works in these mysterious ways to where, you know, with weak adrenals, it sluts down your acid steroids a little bit, which is good. Those that have raging testosterone and lymph not moving well in the prostate, always PSAs climb and climb fast. The hair loss, believe that there is low testosterone, but it may be something else. Well, the hair loss might not be low testosterone. The hair loss might be the subcutaneous tissues of your skin is backed up. Look at a camera and see if you have or a mirror and see if you have a skin ring. That's a defined ring on the outside of your eye. That would be a skin ring. It's called a scurf rim. Or if you see a lot of lymph around that outer portion of toward the last quarter inch of the eye there, around the outside, that's the subcutaneous tissues possible there. But then again, it's possible low testosterone. Good now, because you can get in there, get your adrenals up, get your kidneys going, clean all that out without, hurting the prostate too much, and then your testosterone levels will come up. Everybody's clean and green, everybody's on, and then your maleness will come back there. Then you could use the male, you could use the male reproductive formula. I've got it. Whoo-wee. Come up, baby, come up. You could use the prostate formula for a while first. Check your PSAs, make sure they're down. I highly recommend it's like a $40, $50 check maybe. Go into a lab, negotiate. Most people can walk right into a lab and order up. You want to look at your prostate and see what it is. And if it's above 1, do not use any male reproductive stuff, because elevating your testosterone levels on a PSA of 1 or above would not be smart, especially the younger you are. We've seen PSAs of 2 prostate cancer in 40-year-olds. So we just want to get that down, get those kidneys filtered, get that lymph moving. Then we can hit that puppy and you're good. Let me see here. I don't attribute my hair libido to the corrective diet changes since, no, that has nothing to do with that. Although, again, I've said this before, that sometimes when you get too high spiritually and your energies are up here at the crown chakra, if you will, up here at the tishratil or the pineal gland, all this is up here. A lot of times that doesn't make for a lot of energy down at that chakra. And just the way it's always been. Let me see here. My TIG was so bad that I refer to it as a system shutdown. I was technically alive, but basically a living corpse. Man, well, you're coming a long way, Mr. Truth Forever. Michael, you're pulling yourself up out of this. Man, you got down really bad, didn't you? Well, look at all the people that are suffering. That's why all of you guys are so important, to hold yourselves together, to hold your balance, and to work with us as a team and become healers out there. Let's heal this world up so these people like this don't suffer for so many years, and they didn't need to. You know, since most medical doctors will recommend, if needed, the problem turns out to be low testosterone, hormone injections. That would not be really smart, as you know, because that's going to then make you not produce it at all when the time comes. Good for a short period of time, though. But what's better, long term or short term? Short term feels good now, but long term. There are doctors who advocate taking testosterone injections because they claim that low testosterone increases one's risk of heart disease. No. You know what? This is the problem with that sort of thinking. It isn't low testosterone that causes heart disease. And heart disease is a stupid name. I mean, you got blood occlusions, which is generally a lipid occlusion or a calcium occlusion. That all comes from acids. It all comes from the lymph system. You have congestive heart failure. It's not a disease. It's a lymph system backed up in the heart. You have the calcium loss, so then you have mitral valve or tricuspid valve loss, so you have regurgitation. You have electrical system in the heart that the adrenals control, so that can go off, and you can have all kinds of symptoms, from AFib all the way to throwing PVCs, heart blocks, blah, 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 blah. You just go in and make the body healthy there. The relationship is not with testosterone. The relationship is with the kidneys and the lymph system, and I might add the adrenals. So the connection to heart disease and testosterone isn't through the testosterone pathway, it's through the adrenal, kidney, and lymph pathway that low testosterone means. But they're fixated on this and not looking at causative factors. Where does testosterone come from? What's the role of the adrenals and kidneys? But they don't even know that yet. Medical doctors don't even know the role of the kidneys yet. Their theory, they're still working on dark agey theory of throwing garbage in your blood, throwing sewage back in the blood. That theory. Excuse me. Apologize, guys. Sorry you had to put up with this, but I needed to catch up with these videos, and I don't mind you seeing me going through healing crisis. If you ask people around here, I haven't had one in about 3 or 4 years because I eat fairly well, even though I'm overweight. I eat pretty good. Me and Jennifer are probably about the top eaters in here. And I just haven't had a healing crisis, and I've been working my butt to the bone, and I just turned on one, and I love them because I get so much out, and it's like I feel so much better afterwards. I breathe better, think better, talk better, just like everybody else. So good stuff, good stuff. I'm very against the notion of doing that route. I hope you are, because it's not a good route. Heard you say on your video about adrenals, absolutely, hit the adrenals. But the male reproductive will pop you up. But let's get the inflammation out. Let's get the acids out of that prostate. Let's make sure your PSA is below 1. Now you can hit that baby, hit the adrenals hard. But let's get those adrenals up. Let's get those kidneys filtered. Let's get that lymph moving for a little while first. Try to put up with it the best you can. And then, bam, we'll go after it, and I'll show you how to make that male thing do the thing. Can men regain libido for you? Oh, absolutely. Absolutely. Absolutely, my dear friend. So hang in there, and we'll build Mr. Puppy right up.